Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, July 13th, 2020. Joining us today, Mayor John Tory and Toronto's Medical Officer of Health, Dr. Eileen de Villa. Mayor Tory?
Well, good afternoon and thank you, Brad. And as many people will know by now, today the province announced its plan for the Stage 3 of reopening. Mayors and chairs from across the Greater Toronto and Hamilton area met earlier today to discuss the ongoing response to COVID-19 and preparations for Stage 3. With the province announcing today the plan for Stage 3 of reopening, GTHA mayors and chairs welcome the fact that the province continues to work closely with local medical officers of health, including the Medical Officer of Health for Toronto, and to demonstrate sensitivity to differing regional realities. Reopening in a measured way, depending on local realities, including those in the City of Toronto, will help to protect the gains that we have made in fighting this pandemic. We thank Premier Ford and his ministers for this continuing cooperative approach. Given the increase in COVID-19 cases we have seen in other jurisdictions that have reopened earlier than in the Greater Toronto area, we support continuing the cautious approach we have taken so far in Ontario and in the GTA. With what we have seen happen elsewhere, including in Montreal, we have some real concerns about the manner in which bars and clubs reopen, and will make sure that our local medical officers of health are focused on these establishments to ensure the safety and health of both customers and staff. When we move into Stage 3, all 7,977 restaurants and bars and all 25 entertainment establishments in the City of Toronto alone will be able to open up with health and safety guidelines in place. I know everyone wants this to happen safely, but those numbers give you some idea as to the scale of that part of the Stage 3 reopening and the need for great caution in making sure we do it right. The future of Ontario and Canada's economy will rely on a safe and successful restart process across the entire GTHA and taking all necessary steps to avoid any backsliding. In that same regard, we continue to await news on financial assistance for hard-hit municipalities, including Toronto. We thank Premier Ford for his advocacy on our behalf and look forward to the emergence of a truly national resolution to this matter, which can only be achieved through the offices of the national government. Today, I will be updating residents on a few other key items. These will be exciting in our path forward as we continue to reopen the city. We all know that festivals and events play a key role in the vitality and the livability of Toronto. They are what makes our city so unique and what attracts people from around the world. Today, we are announcing the launch of Drive TO. This new program will enable temporary drive-in entertainment experiences across Toronto this summer. From films to concerts to sports broadcasts, drive-in entertainment is a terrific opportunity for Toronto to re-engage, and Torontonians as well, to re-engage with their city and experience the very things that bring us joy. This program also includes access to programming created by local film arts organizations. And all of this, of course, has been done with health and safety at the forefront. We are doing things differently and learning to adapt to this new way of life. The city's Drive-In TO program will allow organizers to offer these types of events safely, and it will include the following locations: Ontario Place, where we will feature concerts and screenings. Free Drive-In TO nights will include programming by Hot Docs, Imagine Native, and TIFF. City View Drive-In at 20 Polson Pier will feature concerts, screenings, and broadcasts. Free Drive-In TO nights will include programming by Inside Out LGBTQ Film Festival, Real Asian Film Festival, Real World Film Festival, and the Regent Park Film Festival. Friday Night Lights at Downsview Park, presented by the Canada Lands Corporation, will feature free Made in Canada films. And CF Movie Night will take place at CF Sherway Gardens. For those who've been using our active TO program, I want you to know that the city staff are working closely with Ontario Place to make sure, and with our police service, to make sure that Drive-In TO does not interfere with active TO road closures. I'm also pleased to announce new funding opportunities for individuals and not-for-profit organizations to develop projects as part of Artworks TO, Toronto's Year of Public Art in 2021. I named 2021 as a Year of Public Art before the pandemic, and this was to improve access to the arts, create a legacy for our city that reflects our diversity, and to provide opportunities for local artists. The grant funding will help support the arts sector's role in the city's economic recovery, to help advance the Year of Public Art, which will take place next year, so a lot of the works of art have to be started on now, and to help artists who have been especially hard hit by the pandemic. More information about Artworks TO and the partnership grant applications, including eligibility, application requirements, and deadlines, is available on the city's website. I firmly believe that the arts sector, all aspects of the arts sector, will be key to our city's economic recovery from the COVID-19 pandemic, and we need to do everything possible to support this sector. In May, I announced support for festivals, financial support for festivals that have been impacted upon by the COVID-19 pandemic, and launched what was called the Cultural Festivals Recovery Program. This program provides one-time emergency funding and advisory services to cultural festivals, many of which have been postponed or otherwise adversely affected by the pandemic. To date, the city has received 47 applications for requests totaling $537,994 and has already approved 20 of these applicants for a total of $263,000 in emergency funding. Among the initial recipients are the Contact Photography Festival, African Women Acting, Toronto Queer Media Arts Centre, and Big on Bloor. This funding recognizes the importance of such events to Toronto's livability and vitality, and our commitment to have them back when it is safe to do so. But obviously they have to be tided over until it is safe to bring them back, and these funds will help in that regard. It has helped many festivals as well to shift online. Today, I want to share with you that Nuit Blanche is moving online. With an annual attendance of 1.2 million people, Nuit Blanche is the largest free contemporary art event in North America. This year, the festival will engage with its audience through an improved digital experience on October the 3rd. More details will be available soon at toronto.ca/Nuit Blanche. Finally, to continue the progress that we've made to reduce the spread of COVID-19, the city is extending the cancellation of city-led and city-permitted outdoor special events through September the 30th. All outdoor special event permits through to September 30th are cancelled, as well as the permit for the Toronto Scotiabank Waterfront Marathon on October the 18th. This decision includes festivals and other large gatherings held at outdoor sites managed by the city or other public locations such as roads, parks, and civic squares. I know, like many other things I've had to sit here and inform you of, that this is a decision that is very disappointing. For many, it's a difficult decision for us to make, but we believe that it is the right thing for us to do based on public health advice. I want to be clear, this decision does not include outdoor sports facilities permits and other permit activities issued by our Parks, Forestry, and Recreation Division in parks and other city facilities and sites which are permitted in Stage 2 of the province's reopening. We continue to safely and gradually reopen services and amenities for everyone to enjoy this summer. We've made efforts to open many outdoor recreational amenities, including community and allotment gardens, golf courses, tennis courts, outdoor pools, wading pools, splash pads, and outdoor sports fields. Today, we are announcing that the next on the list of things to be reopened will be the Riverdale Farm and the High Park Zoo, as well as the Allen Gardens Conservatory and the Centennial Park Conservatory. All of these will reopen to the public starting tomorrow. Riverdale Farm is home to a variety of livestock and other farm animals, including domesticated waterfowl, chickens, turkeys, and pigs, and is a working farm. While people can still tour the historic working farm's 7.5 acres, people will not be permitted to tour the farm buildings, including the pig and poultry barns. High Park Zoo will be open daily with free walk-through access for the public. When visiting the High Park Zoo or the Riverdale Farm, people should remember to follow public health guidelines so that we can have a safe, fun experience. Allen Gardens and Centennial Park Conservatories will also open this week. Before I finish, I want to just offer an update on the Cafe TO program after city staff held a very successful installation blitz over the weekend, and I thank them for their extraordinary efforts, not only in getting these extra extended patios approved, but also helping to get them installed. I know that many people have taken a keen interest in this program. I had a chance to visit 2 of the locations myself this weekend, and I know that restaurant owners are appreciative of the opportunity to have some more revenue-earning opportunities, and I know that many people who want to patronize these patios are enthused about them as well. So I thank everyone for their patience as we continue to approve, and install these applications. Over the weekend, the installation blitz involved 56 new curb lane closures and 64 restaurants that have been supported through the blitz. So the total number of Cafe TO curb lane closures now is 102, and the total number of restaurants supported by curb lane closures and sidewalk expansions will be 229. After the success of the blitz and due to the high number of applications we've received, city staff will be out all of this week installing more of these patios. To make the program even more flexible, the province has eased zoning restrictions on outdoor patios at our request and at the request of other municipalities, and this has allowed for expanded patios on private property, including parking lots. And I want to thank the Premier and Minister Clark for hearing our concerns and for bringing forward this order that I know will help many more restaurants in our city. Today's update is filled with good news, but we cannot forget that despite these announcements, we still continue to fight a pandemic. We've taken extraordinary measures to fight COVID-19, and we need to keep up our efforts so that we don't undo all of your sacrifices. And so I encourage residents to stay vigilant and follow public health guidelines. We can fight this by sticking together. We did see quite a bit of success in terms of people wearing face coverings, people adhering to the new requirements we placed on the beaches, and other such things, maintaining physical distancing, and this is all good news for which I, as the Mayor, am extremely grateful, as I'm sure are the entire team here that have been working hard to both get the city reopened and get us back as quickly as possible to normal life, but also to make sure that residents were maintained safely and in a good state of health in the meantime. I'd now like to pass along the baton to Dr. de Villa, who can give her daily report.
Thank you, Mayor Tory, and good afternoon, everyone. Over the past 3 days, there were 120 new COVID-19 infections in Toronto. To date, 13,148 people have recovered, an increase of 120 since Friday. Overall, we are continuing to see fewer people diagnosed and hospitalized from COVID-19 in our city. At this point in our outbreak, we are seeing approximately 40 new confirmed cases and less than 2 people hospitalized each day from this virus. As well, the number of new active outbreaks continues to go down. At our peak, there were 108 active COVID-19 outbreaks, and today we currently have 13 active outbreaks. And finally, we've also seen improvements in how quickly positive cases are reported to us by our provincial lab partners. Thank you to our health system colleagues, and especially to the team at Public Health Ontario for their hard work, which has led to this progress. As just mentioned by the Mayor, earlier today, Premier Ford announced that many parts of the province will be moving into the Stage 3 of reopening on Friday. While our situation here in Toronto is certainly improving and we have made significant progress, other locations in Ontario that entered Stage 2 a little earlier are moving to Stage 3 at the end of the week. The residents of these areas are being asked to continue to follow what are now everyday public health actions to keep each other safe. These include washing hands, watching distance, and wearing masks when distance cannot be maintained. The province has indicated that Toronto, along with some other communities, mostly located in the Golden Horseshoe, will join the third stage at a later date. This is, of course, pending continued progress. We continue to monitor and learn from the experiences of other jurisdictions as they move through this pandemic. Our data show that our public health measures have been working. However, the experiences in other cities reinforces that we need to reopen with caution. For example, there have been recent reports of COVID-19 outbreaks in many Canadian and U.S. cities since they reopened earlier this month. Some cities, which had modest outbreaks, are now reporting spikes, whereas others are reporting sudden and alarming surges of infections. It is for this reason that I am concerned that we will see more COVID-19 transmission in our city if we are not careful. The virus continues to spread in our community, and as more people mix, unless we are vigilant, we will see more COVID-19 activity as we ease our public health measures. If we want to keep moving forward, we all need to continue to do our part so that we do not give this virus a chance to spread. This means washing our hands often, maintaining physical distance, wearing our masks, and staying home when we are sick. This is what we must all do if we want to safely move into stage 3 with others in our province. I will keep you updated on our progress as we move forward. In the meantime, a local sign of our progress comes from the National Hockey League announcement last week, naming Toronto as one of its hub cities. Not only is this great news for our local economy, it also demonstrates the NHL's confidence in the people of Toronto and our collective commitment to public health measures and keeping each other safe. The Hub City Plan has all teams living in a bubble where they are separate from the general public. My team at Toronto Public Health worked with provincial and federal public health counterparts to review the NHL protocols with one overarching goal in mind: to protect the health of our city and our residents. A further sign of progress is seen in today's Camp TO launch that welcomed close to 2,500 campers to their first day of summer camp. I know many of us have fond memories of summer camp, and today's Camp TO launch, along with last week's NHL announcement, are important steps that help build our community as we continue moving forward with getting our city back. My team also continues to plan for the Stage 3 reopening of Toronto, and we are working on many new guidance documents to support residents and businesses in making this transition successfully. I will let you know once these documents are finalized and ready for the public. In closing, I know we all want to continue building on the progress that we have made so far. The only way forward is to keep washing our hands, watching our distance, wearing our masks, and working together to get our city back. Thank you, and I'll now turn it over to Brad.
Thank you, Dr. de Villa. So a number of staff are on the line. Should any reporters have specific questions, staff include Marianne Bedard from Shelter Support and Housing, Janie Romoff from Parks, Forestry and Recreation, Carlton Grant from Municipal Licensing and Standards, Jody Callan and Elise Parker from Transportation Services, and Paul Raftis, from Senior Services and Long-Term Care. First question is Mark McAllister from City News. Mark, go ahead, please.
Good afternoon. We're obviously going to be looking forward to Stage 3, even though it's not happening in Toronto or the GTHA today. With Stage 2, we saw some differences between what was happening elsewhere in the province and what happened here. When Stage 3 takes effect, how will it look different when the time comes for Toronto?
So shall I start with that?
Yeah.
So thanks, Mark, for that question. And I think that's an interesting question. I'm not sure that there is a very clear or simple answer to that because it's always hard to predict the future. I would say, however, that the key point here is moving forward in a cautious and gradual way, and in a fashion that actually allows us to take the lessons that we've learned from our current experience with COVID-19 thus far. And so what we're seeing here, as with other parts of the province, is a lower degree of activity and the ability for us to continue to monitor what's happening and to test, trace, and isolate all those who are identified as having COVID-19. And of course, what helps support our ability to do that is the continued cooperation of the residents of Toronto in terms of following those public health measures, washing hands, wearing a mask, watching distance. This is how we can all, again, work together to make sure that we're continuing the progress and that we're gaining the benefits, that we didn't make those sacrifices earlier this year in vain.
Can I only add to that that I have a particularly serious concern, which I've raised with everybody, and I've raised it publicly as well with respect to, and I'm not the mayor that wants to sort of stop people from having fun, but I just am very worried about bars, and I see that nightclubs are left out of stage 3, but bars are included, and there's a provision that's supposed to protect people that says you can only eat or drink when you're sitting down, but it doesn't talk about what happens if you're not eating and drinking and things like that. And I just think we've seen elsewhere in Montreal, we've seen it in some of the cities south of the border, that these have proven to be places where the virus spread can be encouraged or enhanced by crowd scenes developing of people standing up and talking to each other, perhaps talking loud because of the noise, which encourages more of the spread of the water droplets. So that remains a big concern of mine, and given that we have thousands of these bars, I'm not talking about restaurants, dine-in restaurants, but rather bars, I think it's something that I'll be looking to sort of see that our particular concern in this regard is addressed in some way or other through a combination of the provincial orders and also by the advice of, through the advice of our medical officer of health.
To that point, maybe we can be a little more specific, Mayor Tory, on one specific incident that came to light on social media over the weekend involving a restaurant with a party on a crowded patio. There was some video that was released. Having spoken with public health staff, I know warning letters have been issued in the past to this one particular establishment, and it's been said that they will continue to monitor. However, there hasn't been really anything done beyond that. I'm wondering what more can be done to try and keep this sort of thing from happening at places like this.
Well, I think right now the matter in question is, and the video that was widely circulated, is the matter of an investigation by a number of bodies, including the Alcohol and Gaming Commission and the licensing authorities, and I guess they will decide exactly what happened and then decide on what remedy might be appropriate. But, it was made fairly clear, I think, at the beginning that when indoor dining wasn't permitted, which it wasn't as part of stage 2, which we're still in for the foreseeable future for a few days more or a couple of weeks more, that people who are on the outdoor patios, which were permitted, would have to seek shelter elsewhere other than piling into these establishments. So even if that turns out to be the explanation, which I think was one that was offered, it isn't consistent with the policy that was outlined right from the beginning. So we'll await the results of those investigations, but I hope that all businesses, including all of these bars and restaurants and others, will be very careful to follow the rules, because that's what it's going to take for people and for businesses to follow the rules, whether we're in stage 2 or stage 3, if we're going to avoid the kind of backsliding that Dr. de Villa made reference to as a possibility if we don't follow the rules and continue the good work that everybody has been doing.
Okay, thank you. We go next to Brian Passafume from the Toronto Sun. Brian, go ahead, please.
Good afternoon. My first question is for the Mayor. You've spearheaded Canada's push for COVID-19 financial assistance for hard-hit municipalities, and it seems that Ottawa just isn't getting the message about how important this issue is. Calgary Mayor Ed Nenshi described the situation as a hot potato. How frustrated are you and your counterparts that now, in the middle of July, there's seemingly been no new movement on this?
Sorry,
Brian, we're having trouble hearing you. Could you just repeat your question? Your connection's not that great right now.
I apologize. Is this better? Can you hear me now?
Yes, thank you.
Yes.
Go ahead.
Okay, sorry about that. I'll repeat it there. You've spearheaded Canada's push for COVID-19 financial assistance for hard-hit communities, and it seems that Ottawa isn't getting the message about how important the issue is. How frustrated are you and your counterparts that now, in the middle of July, there's seemingly been no new movement on this?
Well, my level of frustration or that of other mayors, it doesn't really matter much. What really matters is that the longer you leave these things, if there's no assistance forthcoming and if an agreement can't be reached, then we have to make some very serious service cuts. The longer that you leave making those decisions, the worse the cuts are. People understand that from their own household budgets. And I believe if you're going to fashion a national solution at some point in time, the national government, of which we only have one, has to say to provinces, and I understand Premier Ford's been trying, others have been trying, the national government's been trying, but there does come a point in time when you have to say, you know what, there's going to be a national solution to this because cities across the country are suffering financially, and we're going to step up and make sure it's one that works for everybody, including for the governments involved. So it's frustrating, but it's more disconcerting to me because of the impact that those cuts would have on people if we had to make them. And I'm optimistic still, even after all this time we won't, but your optimism starts to wane after a period of time.
Okay. Second question, hope you can still hear me. Diverging from COVID-19 for a second, I'm sure you know about the violent weekend in the city we've had with gun crimes and murders. What's your reaction to this?
Well, it's deeply concerning, and I wish I could sit here because I've had this job for 6 years, and a couple of the years there have been, extremely concerning spates of gun violence like this, and I've never been able to say there was a magic answer because I think most people understand there isn't one. And so you have to fall back on the same things we've talked about and that we are trying very hard to do. With more work to be done, which is to support the police, and notwithstanding all the controversy about the police, they have a very important job to do in keeping the city safe, and we have to support them. We have to, continue with the process of trying to find ways to change policing, but we have to support the police while we're undergoing that process of change. We have to change some of the laws, including laws like bail and sentencing, and we have to continue to make more investments in neighborhoods and families, and that is something where the city has stepped up to make more investments this year, but we've got the message loud and clear we have to do more yet again, and that is going to be part of this process of changing policing and re-examining budgets and so on. But beyond that, there is no magic answer anybody has put forward that I've heard, and if there was one, I would have adopted it immediately. And it's just deeply troubling that this is going on and causing the loss of life, but also the disruption and trauma to neighborhoods across the city.
Okay, thank you. We go next to Jake Kavanch from the Canadian Press. Jake, go ahead, please.
Hi, Mayor Tory, Dr. de Villa, thank you. A lot of people are definitely concerned about how quickly phase 3 is happening, especially when we kind of have these X factors like, professional sports teams arriving here from the U.S. Mayor Tory, you mentioned earlier that there are definitely some concerns about bars and restaurants reopening. So I'm just wondering if, there's any worry that the pace in which things are reopening could cause a significant spike in cases, and what would that even mean if there were a rapid rise in cases?
Well, can I leave the latter portion to Dr. de Villa to address, but may I address the first part? First of all, the comments that I made that I'm expressly concerned about have to do with bars more so than restaurants. I think restaurants have a way in which they can safely restart indoor dining and be compliant with the rules with regard to physical distancing, and so they can have, we can all have the best of both worlds, to restore indoor dining, which will be good for those businesses and good for the people of Toronto, but do it in a way that is safe. Bars are a bit of a different question. With respect to the speed of phase 3, I am grateful for the fact that the province of Ontario has continued by leaving the city of Toronto out of the movement to phase 3 this week on Friday, that they are sensitive to the fact that things are different here, and that is something Dr. de Villa can speak to. But the situation here is more complex. It is a much bigger, more densely populated city, and there are many factors that make it just a whole host of a difference as between us and, say, some of the smaller, more remote municipalities or just people outside of this dense populated area. So I'm grateful for the fact the province has continued to listen to the local medical officers of health from the GTA, including our own, and I think we will be able to, as long as that advice continues to be listened to have this reopening happen, yes, as soon as possible, but no sooner than is advisable within the context of public health. And so perhaps on that note, I will ask Dr. de Villa if she wants to say more.
Yeah, so just to add further to that, it's exactly because we have unique and complex circumstances here in Toronto that need to be monitored carefully, and actions need to be taken in concert with those data as we see it. What's happening on the ground should absolutely guide our actions. That's why we've created that monitoring dashboard, so that along with us at Toronto Public Health, you and the entire city of Toronto can understand what is happening on all the different aspects that we are watching, whether we're talking about virus spread and containment, whether our health system is ready and has capacity to manage increased activity for COVID-19 or any other medical condition, whether our lab capacity is there in order to facilitate testing, and of course, public health capacity. So we are monitoring these indicators very carefully. They're the ones that are posted on our monitoring dashboard. We are, of course, watching other data very carefully and taking the time to delve into our data very carefully and very deeply so that we understand our unique circumstances and can offer advice and guidance as we seek to reopen, move to stage 3, while at the same time ensuring that we're doing so in a gradual, cautious, and safe manner.
Follow-up, Jake?
Thank you for both your thorough answers. Mayor Tory, earlier in one of the other questions, someone brought up a video that was posted on social media. I believe it's the one that I posted, but I just want to confirm with you that the establishment that you're talking about that is now under investigation, is that establishment Marble on King Street?
Yes.
Okay, thank you.
Okay, thank you, Jake. We'll go next to Francine Copen from the Toronto Star. Francine, go ahead, please.
Oh, hi, good afternoon. I have two questions. One is, with the cancellation of festivals until the end of September, what does this mean for TIFF?
Well, TIFF made a very specific set of proposals with options in it, for which I thank them because they were very professional to deal with in that regard, and had extensive discussions with myself, but more importantly with the medical officer of health and her team, in order to fashion something that will allow them to put on as much of a festival, some of it virtual, as possible, but do so within the constraints of the public health crisis that we're facing. And so I think the exact details of what they're going to do, we will leave it to them to announce in due course, but suffice it to say that what they will put forward will include elements that have been expressly consulted upon with the medical officer of health and her team, and they were very good about saying, obviously, that they're not going to proceed forward to do anything that wasn't given the green light by the health authorities, and perhaps I'll ask Dr. de Villa to comment.
Yeah, so thanks, Mayor Tory. I think if I was to add a little bit more, it would just be to say that, you know, as you can well imagine, trying to make those arrangements for any organization, for a large festival such as TIFF, I should say, required a lot of forethought and planning. So we certainly have consulted with them to try to offer our best advice around what might be doable without knowing in advance where we're going to be at the typical TIFF timing. But they certainly have been extremely open to considering what can be done, how they can best run a festival and still maintain appropriate safeguards. Because at the end of the day, we do want to make sure that any event that takes place in our city is one that optimizes the health and safety of the residents of the city.
May I just add one more thing, which is that just so people know that our focus isn't by any means confined to professional sports, which are big, and also to big events like TIFF. I had some meetings over the weekend with some smaller arts organizations that are in performing arts, and the objective there is to take what is provided for in stage 3, which allows a degree of reopening of some of those kinds of venues and some of those kinds of theater and dance and other kinds of performances, musical, and tries to sort of work around the practicalities that are involved for those production companies, because they are very anxious to provide the arts and provide the joy that goes with them for Torontonians and to keep their performers employed, but it has to be done obviously in a way that places public health first. And I can just tell you the attitude of the organizations that I've been talking to is exemplary in terms of their concern about and their ability to address public health concerns. And so we're not just meeting with big events and big, well-known marquee kind of sporting organizations, but also with smaller organizations to try and help them get on their feet as well, but still be compliant with the health rules.
And a follow-up question, I suppose that means that we'll be seeing some TIFF premieres at Drive TO, is that?
Well,
Is that
can I distinguish between the two? TIF has some ideas in mind, which I'll leave it to them to outline to the public as to how they can have outdoor screenings, because they know and they recognize, and their discussions with the health authorities have, underlined the fact that an outdoor event shows less risk in terms of the transmission of the virus than an indoor event. But suffice it to say that they may have some outdoor events. In fact, it's quite likely they will announce. The drive-in TO program is one that will be unconnected to TIF, as it were, and will feature all kinds of artistic, film, and even sports presentations broadcast on a screen that will be available to people who will go to places, as you saw from the list of places we'll do it, where people can bring their cars, and they can be safe inside their car. They can be part of what I think will be a fun experience, whether it is film or sports or anything else, so it is unconnected, per se, to the film festival itself.
Okay, thank you. We go next to May Warren from the Toronto Star. May, go ahead, please.
Hi, thank you. This question is for Dr. de Villa. I'm just wondering, with the concerns about the bars, when we get to phase 3, would you consider recommending even stricter measures, like having a log to collect information about customers, or even stricter protocols about capacity, even going beyond what the province is recommending?
So thanks for the question, May. I think we will consider everything that is reasonable and supported by the evidence that actually works towards protecting the health of Torontonians. And I think fundamentally what we're talking about are courses of action that are premised and anchored in our data here in Toronto and our circumstances in Toronto, which are quite different from the circumstances elsewhere in the province. So I keep my mind quite open to all the possibilities, but of course those possibilities need to be informed by our local data and by the best available scientific evidence, all towards the goal of protecting the health and safety of Torontonians.
And can I say, I shouldn't speak on her behalf in this way, but she is not the doctor that doesn't want people to have fun, just as I'm not the mayor that doesn't want people to have fun. We have to do what we think is right, and we will see how things go in the context of what stage 3 means and what it means for bars and so on, and other places where we've seen elsewhere that this has cost a huge price to places that have not been adequately cautious about this in terms of the spread of the virus. And so I will be supportive, as I have been throughout, on the advice of the doctor with regard to what is going to be best in the best interest of Torontonians in terms of stopping us from having any backsliding on numbers that have been improving, with the full cooperation of the public between the face coverings and the distancing and everything else. We just don't want to go backwards from all that progress.
You follow up, May?
Okay, thank you. That's good, thank you.
Okay, thank you. We go next to Matt Bingley from Global News. Matt, go ahead, please.
Hi there. I just wanted to follow up on what May was asking. Because there is such of a concern about bars specifically, would you consider, when we do enter stage 3, could the city say that's fine but no bars? And is that even something that you would even be able to do?
Well, I'll speak initially from the standpoint of myself as the mayor and say to you that I've taken the advice all the way through of the medical officer of health. And if it turns out to be the case that it's going to make a significant positive difference in terms of stopping the spread of this virus and allowing us to keep moving forward and making progress on the health side, I'd be quite prepared to look at measures. And it's complicated because, of course, a lot of the restaurants where I think it will be easier to enforce social distancing and so on also have bars either within them or as a part of them. But I think most people will understand that the bars present a different kind of physical configuration, and a requirement that is presently in the stage 3 materials that say you have to be seated while you're eating and drinking helps to a point, but it doesn't speak to the issue of, well, if you're not eating and you're not drinking, but you're inside the place and you're standing around just having a good time, which I'm not against, but is that something that is going to cause us health problems? So, we'll have to see when we get there what the date is, what the situation is, and what things are open to us, because we don't have unlimited legislative authority at any level, whether it's the city itself or the medical officer of health, to do anything that you want. And maybe the province can be cooperative in doing something that addresses our particular concerns.
Yes, I think that's quite fair, but it does come down fundamentally to what do our data show us and what does the science tell us? What's published in the literature? What do we know about virus transmission? And what are we learning from the experiences of other jurisdictions? I think the more we anchor our actions in the data that we see in front of us, in the science that's published, and in the experiences of other jurisdictions, the more we will be able to ensure the compliance and adherence of residents of the city to the actions and the advice that we're offering them, because they know that it's based on those data and it's based in the evidence, and that it's all about health and safety, trying to balance out and ensure that we get our city back, but we do so in a way that maximizes health and safety.
And just my second question is, I know when it came to stage 2, when Toronto was held back in that sense, it was about a week or so before we were able to enter stage 3, or sorry, the other way around. I'm just wondering, have you had any indication of when we may actually get to stage 3? Has the government let you know?
Well, the government indicated. The government indicated in the material that they announced today that they would review the municipalities that were not moving to stage 3 on a week-by-week basis. But I should make it clear, and I think Dr. de Villa will agree, we were not held back per se. They listened to us, and we put forward concerns based on the data that we have relied upon throughout this entire pandemic, that we felt that some additional time was going to be to the benefit of public health and to the benefit of stopping the spread of the virus. And so they really listened to advice they received from us, and I'm very grateful for that. And it wasn't something they did that in any way we saw as punitive. I mean, we would love to see all of our establishments open as soon as possible because of the jobs and the positive economic impact that will take, but we've placed health first and relied on the advice of our medical officer of health. And in turn, the government of Ontario has been very good at listening to the advice of medical officers of health from this region where things are different because of population density and other factors.
That's right. It was indeed a consultative process, premised, of course, on the data and the unique circumstances that we have here in the City of Toronto.
Okay, thank you. Final question is to Samantha Moya from CBC. Samantha, go ahead, please.
Good afternoon. My question is for Mayor Tory. Over the weekend, the city had 8 shootings in 48 hours. Do you think the city has become complacent towards gun violence in light of the pandemic? And is this a wake-up call that the city has to do something different to address gun violence?
The City of Toronto government will never, and the mayor, myself, will never become complacent about any shootings taking place whatsoever in the city, let alone the kind of rash of shootings we saw this weekend and we've seen at previous times during the last number of years in the summer months. As for new answers, I think that continued and increased investment in families and neighborhoods is something that we have in front of us as something that's going to help, but it helps in the, sort of medium term, not necessarily immediately. I think some changes to the laws we've discussed many times, including with the other governments, especially the federal government, are things that could help in the shorter terms in terms of keeping repeat offenders off the streets. And I think we have to continue to support the police in a very difficult job that they have to do, notwithstanding the fact that we are proceeding with an ambitious program of change and reform that we want to see in that area. And so if you said, are there any immediate answers that we could implement that would be a magic answer or a quick answer that would stop this in its tracks, I wish there was one. And anybody who thinks there is one, please be in touch with me, because I've talked to everybody that I could possibly talk to at every level of government, every expert. I've talked to people from inside and outside the country. I've read articles and books. And we're doing, to a degree or another, the different things that have been talked about in other places. Do we need to do more of some of them? Yes, we do. Do we need to make changes in policing? Yes, we do. But those things can't be done overnight, and I think most people understand that, but there's no complacency whatsoever from the mayor right through the city administration, and including the people of the City of Toronto, who I think are behind all of our efforts on all of these fronts, supporting the police, changing the laws, and investing more in families and neighborhoods, especially the latter one being a necessary long-term solution.
Follow-up, Samantha?
No follow-up. Thank you.
Okay, thank you, everybody. That concludes today's briefing. We'll be back here on Wednesday, July 15th at 3:45 p.m.